So what are the treatment options for it? Treatment depends upon whether the fibroids are causing you complaints or not. If the complaints are excessive bleeding, it can be easily managed with the medications. Like we can give you non-hormonal tablets and hormonal tablets which will control the bleeding. If the pain is too much also, it can be controlled with the tablets. Now, are there any medication to stop the growth of the fibroids? Unfortunately not. There are no medications which can completely stop the growth of the fibroids, because the growth of the fibroids happens because of the hormones which are secreted by the ovaries. So as long as the ovaries of women are functioning, there will be production of hormones which will act as a stimulator or a growth factor for the further development of the fibroid. So once you attain a menopause, the growth of the fibroids decreases and it can stop there itself. Does it require a surgery in every case? Not necessarily, because as long as possible we should try to give you medications. If you are less than 40, we should try to manage you with non-surgical management, because once we do a surgery, though we remove the fibroid completely along with the womb, there is a chance that you can attain early menopause. Early menopause in the sense there is a connection of blood supply between the womb and the ovaries. So once we remove your uterus, there can be a disruption in the blood supply to your ovaries also, and the ovaries may stop functioning earlier than required. Now the functioning of the ovaries is very much important for the maintenance of the heart and the bone of a woman. So as long as possible we should try to avoid surgery. But in case if the fibroid is very big, it is causing a pressure symptoms on the passage of the motion passage area, or is it causing a pressure on the water bag like a urinary bladder, then there is no other option other than to do a surgery. Or if the size is big, or the woman is feeling that she is pregnant, if that much is the big is the tummy, then probably it's an indication for surgery. But here also there are medications which can given for a few years which will shrink the fibroids to an extent. But unfortunately the injections or the medications which are given to shrink the fibroid, once we stop the medications, the fibroids can regrow again. So ultimately, to tell it, the final treatment for the fibroids is the hysterectomy, but we should weigh the benefit and risk, that when we should do a surgery for a woman and when we should manage her with the medications. So there's no much fear of the fibroid. Don't get scared that a growth in the womb is always a cancerous. It's a benign tumor. Benign in the sense it's a non-cancerous thing, and surgery is not the only treatment options available for us. If you have developed fibroids in the early stages of life, a lot of non-surgical method, as I said, your medications are there, or we can reduce the blood supply to that single fibroid. If you have unfortunately only one fibroid in the womb, we can cut down the blood supply on that single fibroid and we can maintain your uterus like that itself. What would be the complications for the fibroid if they develop in a woman who have not given birth to a baby? Definitely depends upon the site where the fibroid is grown. If it is in between the wall of the fibroids, nothing to fear about it. But the thing is, if it is within the cavity, rarely it could be cause for having a miscarriage. And sometimes if it is in between the wall of the womb also, it can grow as the pregnancy grows, as the womb grows. These fibroids can also grow and can cause some pain during the pregnancy, but that's all it. Nothing much to worry about it. So it all depends upon the site of the fibroid and how is the size of the fibroid. But don't be always thinking that fibroid is equivalent to a surgery. Non-surgical options are lot of options are there which are non-surgical and which can be tailor-made for each woman. Thank you for